Everybody, respected Registrar Radhika Reddy, Surya Prabha, Sudha, and special chief guest today, Professor Siddaiah, the professor of MBA and also former registrar of SV University Tirupati, a good friend of mine, and has been traveling this subject. As you know, that national education policy is one which is very important, has come recently. So I request Director of Research Surya Prabha to read the biodata of Professor T. Siddaiah.
Thank you, sir, for the opportunity. Good afternoon, all. Honorable Vice Chancellor, sir, Registrar Ma'am, and other dignitaries, Dr. Sudha, and our special guest, Dr. Tummaluri Siddaiah Garu. Welcome you to the University Board of Research Activities. Under the visionary of Dr. Vice Chancellor, sir, we have started monthly regular meetings related with some motivational research activities in university. And I welcome you all the principals and other faculty members to this special lecture by Dr. Tummaluri Siddaiah Garu. I'm honored here to read Sir's biodata from this university of DR.NTRUHS University of Health Sciences. Sir is a double postgraduate and is having doctorate degree, and he has hold the positions, different positions at SV University, like Professor of Management, Principal, Dean, Campus Director, Chairman of Faculty of Studies, Registrar of Sri Venkateswara University, and his expert member of AICTE, Chairman NAC Peer Review Team. His total teaching experience is 45 years, and he's actively involved in research projects along with research guidance leading to doctorate degrees. Sir has authored and published 2 popular textbooks, International Financial Management, published by Pearson Education, Financial Services, published by Pearson Education. He has extensive knowledge sharing through participation in seminars, conferences, and faculty development programs. Besides this, Sir worked full-time professor academic administrator for reputed institutions in Bangalore after superannuation at Sri Venkateswara University, Tirupati. Visited educational institutions across the country on different assignments and delivered domain-specific and general lectures for students, faculty, and administrative staff. And Sir has conducted executive training programs, especially faculty development programs, and currently Sir is preparing institutions to become NAC members, accreditation activity for all the institutions, and NIRF also. And Sir is helping the institutions in curriculum review and development to suit industry needs. And he is guiding the institutions in implementing National Education Policy 2020. Delivering talks on technology-based education and learning to learn, guiding institutions in adopting outcomes-based teaching learning, and organizing seminars and conferences, helping faculty in writing research-based papers, offering institution promotion services, and designing institution database management. All, so management is one of the backbone. Management is one of the backbone of healthcare delivery system in India. We urge Dr. Siddaiah sir to deliver his lecture and enable us to take some positive steps in our healthcare management. Thank you, sir. Over to you, sir.
respected Vice Chancellor, Dr. Radhika Reddy Garu, members of the faculty, doctors, and student friends. Good afternoon to everyone. It is my pleasure and honor to be with you this afternoon. At the outset, let me thank Dr. Chandrasekhar Garu for giving me an opportunity to interact with the doctors and medicos. And with these few introductory remarks, I will move over to the topic. The title for this talk is the Technology Integrated Medical Education. It is a very fascinating topic. One is fascinated to know much about the topic. That's why I have selected this topic for today's talk. Now, I will start the lecture with a phrase in your NTR Health University emblem. At the top of the emblem, Narayano Hariha. Very, very appropriate to start my today's talk with this phrase, very important phrase. Let me give a few thoughts about this phrase. Narayano Hari is a Sanskrit phrase that translates to the doctor is the Lord Narayan, Vishnu himself, the supreme healer. According to our mythology, Lord Brahma gives life, doctor maintains or sustains that life, and the doctor is equated with the God. It signifies deep respect and reverence to the medical profession, often equating doctors with the divine ability to heal. They are divine ability. The doctors themselves are divine ability to heal. Now, divine ability is used as a noun here. The phrase is part of longer sloka that elaborates on this idea. This is Sanskrit sloka, I don't want to read that, but the translation of that is, when the body is frail and afflicted with the disease, the medicine is like the water of the Ganges, and the doctor is Lord Narayana himself. It highlights that the doctors possess a divine will to heal the afflictions of the people, and their work is seen as great and essential to the well-being of the society. These are a few lines which I would like to bring to your kind remembrance, because everyone is a human being. Then we are doctors, professors, teachers, engineers, and so on. The extension of that is this slide. Everyone has a life. Life influences and influenced by profession, along with the many other aspects of life.
All the participants, please mute yourself.
Different other aspects of life, I have not named all that, but you can guess what are other factors of life or aspects of life. But profession is the one among the several. When profession becomes the integral part of life, profession becomes divine. That's why profession is brought into the life here. When profession is made as the integral part of life, then profession becomes divine. Then you would become Dr. Narayan. I would expect every doctor, every medical, or every health professional to become divine or a divine will. There are certain gaps in the medical professionals. India has the largest number of medical colleges, about 780. There are about 13.86 lakh doctors. The ratio comes to 1:1263, but it is much more than what a WHO standard is. That is the WHO standard. We should have 1:1000, but we have 1:1263. So it's hope that shortly we will to 1:1000. Last 5 or 6 years, there has been a significant increase in medical colleges from 499 to 780, during which time MBBS seats increased from 70,000 to 1,18,000 in 2025. But the concern is that this is very important bullet. The concern is about the unequal distribution of medical colleges and the lack of specialists in some of the rural areas. And if you take into consideration Ayush also, then 1:1 doctor for 834. That means it is less than what is recommended by WHO. And this again ratio significantly differs significantly between urban and rural areas, with the rural areas facing greater shortage of healthcare professionals, even when we include Ayush also. So the need is to increase the number of medical professionals along with the medical infrastructure. That is very important. Along with the medical professionals, we need to increase the medical infrastructure as well. So it is just not enough if you increase the number of colleges and increase the number of doctors, but along with the professionals, we need to pay attention to the improvement of medical infrastructure. But the expectation that society has from medical professionals is extremely high, more than any other profession. Even yesterday, the orator, Dr. O.P. Yadav, was also discussing this point, and even His Excellency Governor also mentioned about this kind of aspects. So it is therefore necessary to ensure that all medical professionals possess the required knowledge and skills. The required knowledge and skills they need to possess. It is not just getting a degree from the university, but getting knowledge and skills. It is all the more important because the societal expectations are very, very high of the medical professionals. Let me say a few things about NEP, National Education Policy. What the National Education Policy is stressing is the holistic and multidisciplinary education. Yesterday, I was very fortunate to have interaction with the great Dr. Dr. O.P. Yadav. He was also talking about the holistic and multidisciplinary education to be incorporated in medical education as well. And this holistic and multidisciplinary education, why we require means the second slide I showed that life influences many aspects of life and also influenced by those aspects. Influences and it's influenced also. So that way, so to take care of the multiple aspects of life, we need to have the knowledge of the multidisciplinary education. The same is put in the form of or in the phrase liberal arts education, which is to be an integral part of all types of education, including medical education. All policy makers, they have to think about this kind of situation in the country, that medical education or engineering education or any education for that matter need to have the multidisciplinary education as an integral part of their core education. Why we require that means after doctor or any professional is a human being. We have what you call the skills of creativity, skills of critical thinking, and he has to harness his own intellectual capabilities as well. For that, your domain knowledge itself is not enough. You need to have what you call multidisciplinary and holistic knowledge or holistic education. That's the reason the policymakers should think of incorporating humanities, social sciences, natural sciences, and arts in their curriculum. Some stage, even NEP. I'm talking about NEP only here. It is not my own version. It is stated in NEP 2020. That's what we are following now all over the country. So, at NEP, it was clearly explained that all medical colleges and the colleges of technology, colleges of sciences, they need to produce at least first 2 semesters of the subjects of humanities, social sciences, natural sciences, and so on. So I think the policy makers can keep in view these aspects and act accordingly. And liberal arts education, it is an interdisciplinary approach, focus on core skills, that is whether you're a doctor or a professor or a teacher or anyone, you need to have critical thinking, communication, problem solving, and analytical reasoning. Then only you can be successful as anyone. Holistic development and also flexibility and adaptability, that's very important. Today you are a doctor, but after some time you may become an entrepreneur. After you may become someone else also. You may become a good teacher also. So for that, you need to have that kind of flexibility and adaptability. The continuation of medical education. Now at the top, we have Ministry of Health and Family Welfare. Under that, we have National Medical Commission. It is according to NEP. So under National Medical Commission, we have Medical Advisory Council. Our Honorable Vice Chancellor is one of the members of Medical Advisory Council. And we have autonomous boards. Under autonomous boards, we have UG Medical Education Board, PG Medical Education Board, Medical Assessment and Rating Board, Ethics and Medical Registration Board. And these boards are yet to take full-fledged activities. Now, once this medical assessment and rating board comes into functioning, effective functioning, then we need not bother about the NAC and other accreditation agencies, because the medical assessment and rating board will become will replace NAC as far as assessment and rating is concerned. Now again we have state government and universities which will be interacting with the National Medical Commission directly, or sometimes they may interact with the Minister of Health and Family Welfare for Government of India. So this is the structure of medical education, and everyone should know about it, because after all, what is happening in the country, when we know this structure, then we can assess of what is happening in that structure. Now, coming to the subject proper, that is the subject of today's talk, that is the technology-powered medical education. Now, I will start with technology. See, as everyone knows about this basic aspect, that technology is influencing every sector of the society, and medical education is no exception. And particularly AI-based technology is playing an increasingly important role at all stages of medical education continuum. That is very important because all stages of medical education continuum. So medical education continuum means even from the beginning of MBBS till you become a full-fledged super specialist or whatever kind of thing you want to become. Till then, you will have the impact of AI-based technology. The technology has the potential to transform the educational experience as a part of a precision education. That is a very much needed anytime, even more so these days, precision education. So what is the precision education? That is the medical education as a precision education. That is a tailoring of education to the specific characteristics of the individual learner, echoing the concept of precision medicine, which denotes prevention and treatment strategies that take individual patient variability into account. That is, this precision education and precision medicine, they go together as far as medical education is concerned. That is delivering, what is the precision education in simple words, delivering the right education to the right learner at the right time. That is the precision education. And we have to make medical education as a precision education. That is very important for any institution. Technology from a virtual simulation to AI-powered tools can transform the education space in ways that were once unimaginable. So what is happening with the technology in the education sector, unimaginable. Some of those things I will highlight in my lecture today, but many other things you can also imagine, and you can also come across those things through websites and so on. 3 dimensions of medical education, how we can use technology in medical education. At 3 levels, we can use technology in medical education. One is a curriculum development. That is, for any education for that matter, we need to have all these 3 dimensions. First, we have to develop the curriculum, including course structure and the course content. That means what is the program? Suppose MBBS, first semester, or how many semesters, and in the first semester, what courses should be there and what should be the content of those courses. Those aspects need to be done before we take on other things of education. Curriculum delivery. So next aspect is curriculum delivery, that is the teaching, assignments, presentations, project, case studies, simulations, paper publications. They can all be considered as a curriculum delivery. Then assessments, examination scheme, assessment tools, feedback, and so on. So these 3 aspects are constituents of any education for that matter, any formal education. So in our medical education also, we have to have these three dimensions. Now, how technology plays a role in each one of them, we are going to deal with. The same thing I have put in the form of a visual, because the visuals are more effective than the text. So that's why I have put that the same thing in the form of a visual. Then how we can use the technology, what kind of technology we can use, suppose the curriculum development. That is, we have to develop the curriculum. So to develop the curriculum, see, medical knowledge and skills evolve rapidly. It is evolving with new diseases, new research findings, new treatments, new drugs, new procedures, new guidelines and regulations, and so on. So any knowledge is not static. It is evolving. So more so our medical education. Therefore, designing the effective curriculum can take years of refinement. It is not that easy, because to develop a particular curriculum or design a particular curriculum means we have to work so much and bring in so many new things into curriculum. And it is not an easy task. And some teams, they work for years together to bring new content into the curriculum. Now, the technology has come into handy in the sense that that can help us so much to develop new curriculum and to have some kind of new knowledge and skills for the learners. What kind of technology we can use for curriculum development? We have some apps, only few things I am just highlighting, because there are so many others. We cannot list out all that, but a few things. Suppose the first co-pilot AI app, it assists in reading and summarizing scientific papers, identifying key points and generating summaries. Why we require all that? Because when we need to develop a curriculum, we need to know what is happening and what is the latest. And what is the latest? How do we know? When we go through scientific papers, then we'll come to know what is the latest. Then we have another app called AI Research Assistant. It is a platform. You may call it as an app or any educational platform. It helps educators identify recent studies and integrate them into course content. There is also AI Research Assistant Semantic Scholar. That's again an e-platform. It can you can find and organize the most relevant and up-to-date scientific literature and can process the latest scientific literature to generate updated course materials on real time, ensuring students receive current information. That ensuring students receive current information, it is very, very relevant, even these days. It can also identify outdated content. That means it can also identify outdated content, which is there already in our curriculum. It is identified by this e-platform. So that is about technology in the curriculum development. Now, when we come to curriculum delivery, there are many things here. Traditional teaching methods, we have a rich history and have been proven effective for over time. That is the traditional teaching methods. We have personal connection in traditional teaching. Still, many of us are following traditional teaching only. Then we have hands-on learning, classroom management, and the social development. Because time is limited, I don't want to elaborate each of them. Then we have technology integration teaching. See here, suppose if you use technology alone, integration teaching. So if you just visualize that a day may not be so far off when you need not get admission or seek admission in any of the institutes, any of the medical colleges. You can sit at home and do whatever things are required to become a good doctor. Because The technology platforms are such, and technology platforms are so effective that you can get everything at your desktop. You need not seek admission in any of the medical colleges. That day cannot be so far off. That is the power of technology as far as education is concerned. Not only for medical education, even other kinds of education, whether it is a science education or engineering education or technology education or humanities or arts and whatnot. So that's how the technology is playing a vital role in all these endeavors. You see, personalized learning. So what we are doing in the traditional teaching is that we have a class of 150 students. Just we teach as we know. So irrespective of the students are listening to us or concentrating on what you are teaching, whether some are bored with what you are teaching, some are so much interested in what you are teaching like that what we call one size fits all approach. That what we have been doing over several centuries. But that kind of education is not relevant these days, particularly with the technology integration. And with the technology integration, you can have access to vast resources sitting at home and having on a mobile phone. You can access resources anywhere in the world. In any website or any portal, you can access the resources. That is possible. Then you can have collaborative opportunities. You can collaborate with people wherever they are, whether they are in the US or Canada or whichever country they are. You can collaborate with them, and also real-time assessment. That's very important. When we take up this assessment part, there I will talk about something more about this assessment, real-time assessment. Then we have to have balancing traditional teaching and technology integration. This balancing is very, very important, because what happens is that today or some time back, I have come across some news that some people are using AI for treatment. That means they go to ChatGPT and upload their symptoms. Then ChatGPT or DeepSeek, these are the apps. They suggest some medicine. They are using those medicines. And they are not going to the doctors, human doctors. That is happening now. Not in all cases, but in some cases we come across that kind of a situation. But that is not a right kind of a situation. Because I have also used ChatGPT and I have also used DeepSeek, and whatever information they give to us, that is not 100% correct. There must be some expert to validate that. That is very important. Suppose one MRI or some other X-ray, if you refer to the ChatGPT, ChatGPT may read something and give some kind of remarks. But we cannot rely upon that. There must be a radiologist, qualified radiologist, who can read it. But you can integrate, the radiologist can integrate his knowledge with the knowledge given by ChatGPT or DeepSeek or any other app of that kind. So that expertise, human expertise is always required. That's why we call it as a blend of teaching approaches. So that means technology can augment our teaching methods. But they cannot be allowed to replace our teaching methods. Then you have professional development, because the professional development, what I mean by professional development here is that every student, every faculty should have thorough knowledge of the technology. Not the hardware side or software side, but application side. Which kind of a technology, where we can use it? In the education field, I'm not talking about the practicing. I'm talking about only education. In education, what kind of technology, where and how you can use it? That kind of development, professional development, everyone should have. Whether it is a teacher, a professor, or a doctor, or a student, or a nurse, or a physiotherapist, whoever he is, he has to have the knowledge of the technology. Then only you can use that technology in appropriate situations. And another important thing is it is a student-centric learning. It is not relevant if I just teach or talk whatever I know. I should talk what the students require, what the audience require. I should talk. So that way, the entire education program should be student-centric. And you must have a supportive environment, must have fostered a supportive environment. That environment has to be developed. That supportive environment should be developed by the institutions or universities. This is a very important aspect, the immersive technologies, because this is the core of the technology integrated education. Immersion is a general expression of experience one gets when he is intensely absorbed into something, forgetting the surrounding environment. Suppose when you are in a deep meditation, okay, when we are in a deep meditation, you do not know what is happening around you. Okay, same way, you get immersed in the technology and you forget about what is happening otherwise. That kind of a technology we have, and that kind of a technology we have named them as virtual reality and augmented reality. That is what kind of, that is in the 3D environment, we'll have those technologies. And the major technologies which we can use in our education is the virtual reality and augmented reality. And because they would give us hands-on learning. As I was mentioning a few minutes back, that no, you can just dispense with seeking admission in medical colleges. How it happens, not only medical, even other courses as well. So how it happens means we have technologies like virtual reality and augmented reality. They do wonders as far as education is concerned. Suppose traditionally medical students, they used to depend upon textbooks and other clinical placements and so on. But now, most exciting development is the integration of virtual reality and augmented reality technologies into education. Okay. So these two offer an entirely new dimension of learning that allows the students to develop and practice skills in a controlled and risk-free environment. With VR, that is the virtual reality, students can immerse themselves in realistic clinical scenarios such as performing surgeries or diagnosing patients in a simulated hospital setting. That is the great advantage for the medical professionals. In a simulated hospital setting, they can do all kinds of medical activities. These technologies virtually provide environment and the learners to make decisions, observe outcomes, and so on. Because decision making is so much involved in medical profession. Because at every stage you have to take decisions. Because whether it is diagnosing the disease or giving a treatment and following up and so on, every stage you need to have. You need to take some decisions, and sometimes those decisions may become very, very critical, crucial as well, and very costly also. Costly in the sense not in terms of money, but in terms of the patient care. Okay. And virtual reality, a little about virtual reality. I don't want to mention so much of virtual reality because it is playing very, very important role in medical education. That's why I want to mention a few things about virtual reality. What we mean by virtual is close to. The meaning of virtual is close to, nearer. And reality is what is witnessed. And thus the phrase virtual reality suggests close to the reality. They are not reality as such. Because suppose the simulated hospital setting, it is not real. It is only, what you call simulated. In technical sense, virtual reality is a computer-generated simulation where the learners can interact with an artificially three-dimensional environment by using electronic devices such as special goggles and sensors. Technology creates some kind of virtual environment for the learners, complete virtual environment in which the doctors, the professionals can work. Virtual environment is created with the computer hardware and software, while the users might also need wear devices such as goggles, handsets, and bodysuits to interact with the environment. And in the virtual environment, you can have vision, hearing, vibration, touch, and smell also you can have it. In a virtual environment, you can have all that. In real environment, you are having all this vision, hearing, vibration, touch, and smell. The same things you can also expect in a virtual environment. That is the greatness of the technology. The more deeply users can immerse themselves in a virtual environment and block out the physical surroundings, the more they can get in the they can get with the virtual reality. The handset supplies the visual and audible information about the world. The participant is exploring while myriad sensors and technologies translate the person's movements into the virtual world. I will show you some images as well after a few slides. The imagery virtual reality may be constructed from photographs or film real places. It can be entirely computer generated. Don't think that those images are just created in the vacuum or from the vacuum. So they are already the photographs and something created by the software. And VR allows people to explore just as about any world that can be imagined. Any world that can be imagined. And types of virtual reality, we have non-immersive virtual reality, semi-immersive virtual reality, fully immersive virtual reality. Broadly, we can classify virtual reality. I'm talking a little more about virtual reality because it is very, very important in our education sector. So it is immersive, non-immersive, as the name itself speaks. That it just presents some videos and some kind of video games. As an example, you can also think about the technology of this dimension. And also we have semi-immersive. Okay, so this is one kind of thing, virtual reality. And this is very important, immersive, fully immersive, delivers the greatest level of virtual reality, completely immersing the user in the simulated 3D world. So nothing outside is thought of in this kind of a fully immersive situation. It incorporates the sight, sound, and in some cases touch also. You can touch the people. So you're here, but your avatar does everything in the virtual environment. Doctor is sitting here, Honorable Vice Chancellor is sitting here. While sitting here, you can touch anyone in the virtual environment, and wherever he goes in the virtual environment, whether he goes to Sydney or he goes to some other place and interacting with the doctors, you can also give a handshake with those people also. That kind of feeling is created by this virtual reality. For fully immersive experiences, users wear special equipment like headgear, goggles, gloves, and so on. The environment might also incorporate such equipment like treadmills and stationary bicycles. Those things also you can have in this virtual environment. And whatever you can think of in this real world, you can also think of the same in the virtual environment as well. So these are the features of virtual reality. They are realistic visuals. You can have it, whatever visuals you come across. You can have a spatial audio, realistic sound effects. Suppose when we are moving or when we are shaking hands with someone or we are working with someone else from outside your place, okay, in a virtual environment, you are all meeting together. So there, even sound effect also you can have it. Suppose what other people speak about the topic and how you interact with those people, that kind of effect also you can have in this virtual reality. And this also touch, that is multi-sensory haptic feedback, you can have it because vibrations, full body suits that lets users experience real world bodily sensations in virtual setting. And this is a collaborative virtual reality. You can collaborate with anyone. Suppose you are doing some research or you are doing some surgery, very critical surgery, you are doing it. And you can collaborate with the people wherever they are. So you are enabled by this kind of technology, highly advanced technology in the name of virtual reality. People from different locations come together in a virtual environment to interact with one another, with each person represented by a projected 3D character. Vision Pro, which is the Apple's first spatial computer, combines mixed reality and VR to give immersive experience. So that's a kind of thing. As an example, I told you about this Vision Pro. Students can use the virtual reality to attend the summits, conferences, and company networkings even without leaving the classroom, reducing their carbon footprint and expanding their networking opportunities. That is a great thing about the technology, interactive technology and immersive technologies. That's a great thing because sitting here and you can listen to people from anywhere in the world. Suppose on some advanced institute of institute like MIT, if you want to listen to people from MIT, you can interact from wherever you are. You are in a remote place of Andhra Pradesh, but from there you can use it. You can use your mobile and interact with the people wherever they are. Interact means it is a two-way. It is not listening to them. You can also put some questions to them and you can get answers, suitable answers. Now, this is the slide which I have downloaded. You can also just see. They are all virtual images of the real people. They are avatars created by the software, virtual reality software. They are created. And they are interacting with each other. As I told you, they can touch with each other, they can talk with each other virtually in the virtual environment. So as if you are in a real environment, and you can also do whatever kind of thing, even fun also you can do there. Fun also, because fun is an integral part of medical education. Perhaps many people would have not noticed that. So the same thing, conferences, you can have conferences anywhere, people from anywhere, you can meet in the virtual environment. The images which are shown there, they are avatars. So to create your own avatar, again, it is very expensive because what kind of dress your avatar should have it, whether we have tie and all that or any other kind of a special what you call dress, you can have it because there is no market for such kind of things also. Okay, so they're all avatars, they are meeting, and when they are meeting, and you will have the sense of listening or sense of talking to them, sense of touching, sense of smiling, and so on. That is a virtual environment. And complete 360-degree views. You can look at the things 360 degrees and adaptive environment. That is very latest development in technology, adaptive environment. Suppose you're in one particular environment, talking to people from outside, but you are not at the same wavelength with other people. Now it has to be adjusted because that adaptation. So that adaptation is not done by you. The AI itself will do that adaptation for you, where you will be comfortable. Because if I am speaking to a professor from Harvard, I may not be, comfortable in speaking to him because his jargon, his concepts, and his level of knowledge is so high. I cannot follow him. In that case, AI itself will adjust the environment in such a way that I can speak to people with whom I can be comfortable. That adjustment, adaptation can be affected by the AI itself, technology itself. You need not ask them. Now, this is virtual reality image. Okay, so generally you come across this in anatomy lab, but here you will have this, and a little matter about this is using your VR technology, that is virtual reality technology. A student can visualize several anatomical structures online. While the educator describes the model and features, the students can point the camera maker to a specific spot to magnify the image and better understand the anatomical structures described in the lecture. So that is very important thing, because when we have anatomy class, and you may come across this kind of bodies, and you may dissect them, and you can also see the beams and other kinds of tissues and other kinds of things. But when we have this virtual reality, you can go deep into the cells, you can go deep into the molecules, you can see how the molecules are behaving, or how the cells are behaving, all such kinds of things, minute things, even your microscope cannot show them, all those things. So you can go deep into the molecules level, or even at the bottommost level, you can see. That is the greatness of technology. Dissect button is also available to remove the layer and view underlying anatomical features. That is, dissect button. With that, that will remove each one of them. So at the surface, what is visible? Just below the surface, what is visible? Just below that, what is visible? That's why you can go deep into the cells and molecules and so on. Okay, so recently people are talking so much about quantum computing. So what is that quantum computing? Is nothing but atomical behavior. Subatomical behavior. That is, we have atoms, and within the atoms we have other nucleus and all that. And within those things, again, we have certain other things. Okay, but your dissections or your microscope and other things cannot show you all that. But the technology can show you even within atoms, deep into the atom, how the things are behaving. That's what we call quantum computing. It is a term derived from quantum physics. Now that quantum computing is highly helpful in the medical education and the medical field, and you can see the things particularly like cancer cells, and how, whether they are erupting or whether starting, or whether they have started growing, at what stage they are. You can just peep into that at the bottommost, even before they are visible as damaged cells or damaged cancer cells and all that. Before that also, the factors that may contribute to that damaged cells, those factors themselves can be analyzed, can be studied before you come across the actual cells of the cancer. So that kind of advantage we have with this kind of things. So the same thing you can also undo. We have that do command and undo command. And next comes this augmented reality. So this is also, it also goes along with the virtual reality, but it can also be separate. It is involves overlaying visual elements, sound and other sensory stimuli into the real world setting. It is something like, I will show you one image. Yeah, you can just see this. Suppose you are reading medicine book, say Harrison, you are reading, great book, great author. So you come across the heart there. So when we put the camera, augmented reality camera, and the entire information about the heart, you can have it. Entire information about the heart. And whatever is written in the Harrison or some other book, great authors are there. And the whole thing you can have in that image itself. So that is the greatness. Because again, if you turn, you may get some other pages of lungs or kidneys and all that, or whatever kind of even cells or some other small parts also. There you can put your camera, and that will be amplified, and all kinds of information is given to the students. You have AI apps also. You can download and you can use them. It is something like a library somewhere, and you can have some kind of information, what kind of books they have, and within the books, what kind of contents, what kind of content is available in those books. So those things you can just see from wherever you are. Suppose when you just put your camera on some part, this is engineering part. So if you put that one, the entire thing about that particular machine or engine or whatever kind of thing you are seeing, and you will have that kind of, you will have more information about that. So I will skip this. Now coming to the assessment and assignments. See, assessments are very, very important, particularly in medical education, and a very, very difficult task as well. Because exams are highly challenging in medical education, particularly for teachers, as they have to ensure that the students are competent and safe practitioners. They have to ensure that. It is not just giving some marks or passing them or giving them kind of awards or rewards. We must ensure that they are competent and safe practitioners, because they are going to deal with human lives. Human life is highly precious. Okay, so that particular aspect one should keep in mind. Accordingly, we have to do the examinations. It also helps educators to measure the effectiveness of their teaching methods. That's a very important aspect here. See, always we think, I am also a teacher. I also think that whatever I want to do as far as assessment is concerned, I keep in view only the students. That whether they have learned or whether how much they know and how much they can do and all that. But the other side, when you look at, it also reflects your teaching competence. It also reflects about the effectiveness of your teaching. Suppose many students could not pass the examination. We, the teachers, tend to blame the students that they have not studied well, they have not done this well, and they are indisciplined, this, that, and all that. But something wrong with the teacher himself or herself. That is to the point to be remembered. Because many of us are doctors and also teachers. Doctors come teachers, and I am also a teacher, and we should think of assessments that way. So assessments, they become feedback to the teachers. That is the point which we have to remember. Assessments is not just to give some marks or passing the students, or allowing the students to graduate, but it is very much a feedback to the teachers concerned. Technology, particularly AI-based technology, can be utilized in various ways for assessment, medical examination, to avoid subjective bias and realistic assessment. The scope of application includes the evaluation of theoretical knowledge, assessment, diagnostic. Suppose these are the things, assessments, what kind of assessments you can have. Automated essay scoring, diagnostic skill assessment, interpretation skill assessment, prescription writing skill assessments, emergency response skill assessments. So these are all some names I have put for whatever activities you undertake as a doctor. Automated essay scoring, it is again very important because when we write some essays, some essay questions do appear in the examinations. And whether formative examination or summative examination, some essay questions they do appear. When those scripts the teachers have to evaluate, they have to read and assess and all that. Sometimes it is very subjective, and sometimes the bias of the teacher may get into the assessment. So these things can be avoided with the technology, because technology can scan your answer and accordingly it will evaluate. That what we call automated essay scoring system. That is what we call enabled by AI. And gaming tools are very important. That is, quizzes, puzzles, matching, drawing, and so on. They are very important in the assessment of the medical students. And the procedural skills also. Procedural skills can be assessed with VR, where a simulated patient will be presented in a virtual environment and the learner is asked to do a procedure. Okay, students will be assessed automatically by the steps they follow, and the system will give immediate feedback, because already the actual procedure, the real procedure, the correct procedure is built into the system. So when a student does some procedure, automatically that will be compared with the loaded procedure. Accordingly, it will be assessed. The establishment of VR labs, that has become a common. Perhaps Dr. Chandrasekhar will also think of establishing some VR labs in some of the colleges. That's very important. Diagnostic skill assessment. That is another kind of skill doctors should possess. All AI tools can be used for diagnostic skill assessment. Case study are already built in. AI can formulate its own different sets of case scenarios to assess the learner's knowledge. Critical thinking skills. Here, critical thinking skills. That's why we need to have critical thinking with your core knowledge. With your domain knowledge, you may not get critical thinking skills. You need to. That's why we need to have interdisciplinary knowledge. Okay, that's what we call the holistic knowledge, multidisciplinary knowledge, so that your critical thinking can develop. Another important point in this regard is AI can also create real-time scenarios based on the learner's knowledge level and adjust them dynamically so that assessment will be individualized. That is, you give one patient to you present one patient to the student. He is not able to do it. So what you do is you may put 0 or you may put 10% of marks or 20% or whatever kind of thing. But in the AI assisted assessment, and they would give next level. Suppose one patient is presented and the student is not able to do the things properly. Then next level will be presented to the same student. Again, AI will assess whether he is comfortable at that level. Suppose still he is not comfortable at that level, again another patient will be presented to him. So like that variations can be affected by the technology. That is a great advantage. And interpretation skills, that is very important in medical field, because when we have MRI and other kinds of imaging science outputs, then interpretation is very important. So already AI algorithms are there and preloaded sets of extensive investigation data, including typical and analytical findings of various diseases. Now, when you ask the student to interpret, physically, whatever kind of things you want to test that student, so obviously the student performance will be compared with what is already preloaded in the system. Accordingly, assessment will be done. With the ability of AI to create its own sets of data for the same condition, individualized assessment can be done. Okay, that is individualized. Even teaching also that again another point ability is there. With regard to that, I will talk about it. Prescription writing skill assessment. This is again very, very important for the medical professionals. So prescription writing skills, that's again a big thing. That also it will be assessed whether he has got a proper writing prescription writing skills or not. So that will also be evaluated by the AI assisted technology systems. And emergency response skill assessment, that's again very important because how the doctors, students will react to the emergencies. So sometimes they may become upset, they become nervous, sometimes they do this, that in that nervousness. This and that, that is very important because in emergency response skill is very, very important in Medicare. Because what happens is that the patients come in a very critical stage. At that time, the doctors sometimes the attendants of those people, they are crying, shouting this, that, and so on. The doctors do not respond to all those things. So he has to do according to what is required. So whether the learner is able to do this or not, that is to be assessed before we award any degree to the student. Okay, clinical reasoning skills also. Clinically, when you come across, when a learner puts something, what is the reasoning? Whether he has got reasoning skills or not, those things also will be assessed by the system. And this MCQ is very important because MCQ, preparing MCQs, it is not an easy task because I have also done that with Herculean task. One MCQ question, if you want to set something, it may take 2 days, 3 days. Okay. So that way, writing effective MCQs is a complex task that requires a strong medical knowledge, integration of classroom concepts, and careful avoidance of common issues. For MCQs, each question should have one clearly correct answer and plausible distractors to minimize guessing. So that kind of a thing has to be done. Now the technology can do this. Because human doctors, they also try their best, but sometimes may not be able to do it properly. But the technology can do those things wonderfully well. Short open-ended questions also, because in your medical examinations, short open-ended questions are very common. So essay questions might be there, and short open-ended questions are there, and how you can evaluate those things. That is also done by the technology assisted evaluation. And personalizing medical education, precision medical education, already I have said something about that. Again, we have to look at the learners' data. So that way, when we know about that, accordingly, we have to adjust our teaching methods. Personalized approach helps students focus on areas where they need the most improvement, ensuring more efficient. Suppose AI-driven platforms can assess how well students understand certain concepts and recommend additional knowledge and practice exercises. This is again important for doctor teachers. That is doctors being involved in teaching, and they have to select the right method of teaching. What is that right method of teaching or effective method of teaching is again made easy. Selection is made easy by technology. Instructor can also use AI tools to identify common areas of difficulty. By analyzing data on student performance, course completion rates, and clinical outcomes, educators can gain insight into which teaching methods are most effective and make evidence-based improvements to their curriculum. Additionally, data analytics can play a crucial role in evaluating the effectiveness of medical education, This data-driven approach ensures that healthcare education remains relevant and aligned with the evolving needs of the field. We have this intelligent tutoring system. Sometimes people say that no, we don't require any teachers because the system itself becomes a teacher for anyone. So that way it is known as intelligent tutoring system. Okay, so there students can interact with the system, and the system can give whatever kind of knowledge that particular learner wants or requires, and accordingly learners can affect their education education intentions. And the chatbots also, you have interactive tutors and all kinds of evaluations, the feedback, everything they can have it. Suppose virtual teaching assistants also, because many of the things are done by the technology, so that the doctor or a teacher can become free to do many intellectual things. Suppose evaluation, it is a very time-consuming process. Setting question paper, it is a time-consuming process. So all these things can be, relegated to the technology, and the doctor-teacher concerned can concentrate on other what you call the intellectual capabilities. And virtual patients, that is very important because you can present different kinds of patients to the students and teach them what kind of ailments they have, what kind of conditions they are living, and all kinds of things. Suppose madam is there, so madam, SPM. So she can create one social environment or some kind of a rural environment, rural atmosphere where the patients have their own problems, health problems, and how you can deal with those things. So like that, different patients, suppose in a village, there are 100 households, and in each house or in each village, some 10, 15 people can be identified, and you can also know what you call diagnose their diseases and the causes of those diseases, and the preventive medicines and preventive activities can be suggested when you have these virtual patients. Different kinds of virtual patients you can create. The imagination is the limit. Otherwise, you can have e-learning platforms. You have different e-learning platforms, and I just mentioned some of these e-learning platforms. You can download, or some of them, they are very expensive, but they are useful. But universities like our NTR University can subscribe to them and use them in the classrooms. And access to AI also there, and we have different kinds of what you call apps and also platforms, and you can download and you can use them. And academic medical research, that's very important in medical education, because many teachers do not know that medical research is part of our curriculum, part of our education. Because people think that medical research means only R&D institutions, they can do it, or pharmaceutical industry people, they do it, and we have nothing to do with this. Like that, people have some kind of misconception. But medical research is very, very important in every teaching. Every teaching, in the sense that at every level of teaching, medical research is very important. Suppose what is the difference between ordinary educational institutions and advanced educational institute? In the advanced educational institute, whatever is the subject, they go to the class with new things, with new insights, with new thoughts, with new tools, with new knowledge, with new skills. They go to the class. How they go with every time with the new things? Because they do research. because they do research. Teaching is research based. It is not blah blah, something what I am doing here. It is not like that. It must be something innovative. Teaching must be something innovative. When you go to the class and you must give some new points to the students, which they cannot get elsewhere. Suppose we have websites and so many kinds of things, video lectures and all that. Suppose if you give or if you share that kind of knowledge with the students, and what's the greatness of you as a teacher? The greatness of you. When you share the knowledge which is not otherwise available to the students and other learners, then you are great. And how it can happen? It can happen only when you also undertake research. In advanced level institutions, in all kinds of subjects, whether it is engineering, medicine, or management, or sciences, research is a continuous endeavor. Without research, when you go to the classroom, means it is not acceptable. Okay, just having some degree, whether post-graduation or no PhD degree, it is not enough. You have to further. It's a PhD or DM or whatever kind of degrees you have. It's only just some initiation to further research. You have to go further. Suppose the PhD, you have some initiation there. You have to go further. Then only you will become good researcher. Suppose the DM, some initiation is there for research. You have to go further. When you go further, then you have things, some innovative things, some critical things, which you can share with the students. Otherwise, the students cannot get anywhere. Otherwise, whatever kind of things which you talk, that is already available in the textbooks or in the journals or in websites, means that what way you are better than those? That question comes. Suppose there is one platform research rabbit AI-based tool enables researchers in medical institutes with ways to search for articles and writers, monitor research landscapes, and collaborate with the research from other institutes. Collaboration is very, very important. Individually, you cannot do good research. Also, ever great you are, individually, you cannot do good research. It's only in collaboration, particularly in the medical field, because many things are integrated there. And disease means that whatever kind of disease a patient has, it is an integrated one. It is not caused by any particular isolated thing. It is an individual. It is an integrated one. Suppose many people do not give much importance to SPM, but SPM is very, very important in any medical field. Okay, because many things we have to see behind the disease. What is the cost? So, strength and extensive literature search is lie in the visualization maps based on network view and so on. And these are all important points for medical research. And these are the tools for academic research. These are all the what you call apps or e-platforms for academic research. Even very simple. Suppose you ask ChatGPT, this is what I want to do. You just suggest one research topic. It will give you some 2, 3 research topics. Would you accept them? No, you should not accept it. You have to go further. Because the ChatGPT, what it gives, it won't create any new thing. Whatever is already available in the internet, it will search and summarize and present to you. It will not create anything. Okay. It can create anything new. It is only human. Humans only create new things, not a technology. Technology can augment. It cannot replace. Even research also. This gamification now has become so important in medical education that also you can think of gamification, quizzes, puzzles, matching, drawings, and so on. This vibe coding, it is assumed so much importance. How it is relevant is that is suppose you have one problem, some small problem. Okay, but you cannot just elaborate that problem. Unless you elaborate that problem, the programmer cannot write the software for that. Now technology has become so easy, has made the things so easy that you just express whatever views you have about a problem, and the software will be developed by the system. Okay. Earlier, suppose some 40 years back, I learned about the programming. There, flowcharts and other things we have to first develop, then followed by programming and so on. But nowadays, all such things are dispensed with. Just give your issue, your problem to the system. System will develop software required for you. The last slide. With this advanced technology and its ability to generate real-life scenarios in the virtual environment, the students can get a fully immersive training experience before they enter a hands-on patient scenario. Today, the tech-heavy classroom better prepares the students to handle stressful situations and ultimately offer a higher level of patient care and never be patient care than ever before. That is the great advantage for this generation of the learners. Everyone is a learner, whether you're a professor or doctor or MBA student or +2 student, everyone is the learner. Okay, so this is the my presentation. Thank you very much. If you have any questions, I can take some questions if Dr. Chandrasekhar sir allows me to take your questions.
Thank you, sir. Siddaiah garu. Collaboratively told that importance of research is very, very important. So definitely it goes in a long way. And also the faculty and also students to start because our honorable CM so will be establishing a quantum University campus Amravati. I think we should most of the students are also they're not happy because they download the slides from the slideshow, they are vomiting out. So what the teachers also should change the methodology. They should have their own techniques and present to the. I think there is really modern tools have come, but use them appropriately and try to develop a good teacher. So this is sense of it. I thank Dr. Professor Siddaiah garu, having come since I know him from 1988 when I joined as an assistant professor of Tirupati. He has been giving lectures in various parts of the country, evening between 3 to 4. So there's another session, I think, IRF. I think that is also very, very important. So I request you also to kindly join. Any questions? I think we'll be likely to address the audience.
Sir, good afternoon, sir. Sir, am I audible, sir?
Yes, sir.
Sir, am I audible?
Audible, sir.
Sir, good afternoon, sir. Good afternoon, sir. Thank you, our Honorable VC, Sir Chandrasekhar, sir, for giving us this opportunity to hear this. And on behalf of NRA Medical College, sir, myself, Dr. Arif Pasha, Critical Care HOD, sir. I sincerely thank for this distinguished speaker, sir, Professor Siddaiah, sir. for enlightening us and engaging this session, sir. Sir, your talk has not only deepened our understanding, but also inspired us to think differently regarding this technology helping our medical education. And especially regarding this virtual, fully immersed virtual, this one, sir. Because whatever the technology we are lacking is the human touch. So even this touch and is also included in this virtual session, sir. Sir, from my side, a small doubt is there, sir. So how do we ensure this technology-driven education still nurtures the empathy and communication, sir? One. The other one, sir, do we see this artificial intelligence and virtual tutors partly replacing the faculty roles in the future, sir?
What
Sir, yes,
shall
sir.
I react? Sir, what you said,
Yes.
the empathy,
Yes, sir.
that
Yes,
cannot
sir.
be replaced by any technology as of now.
Yes.
We do not know
Yes.
what is going to happen in future, but as of now,
Yes.
that empathy, that feeling, oneness,
Yes.
cannot be done by any technology. So that's why what I have mentioned is we have to integrate. The technology should be integrated into our universe.
Yeah.
That we don't allow the technology to replace us.
Yes.
Because I just mentioned one example also, like
Yes, sir.
MRI or what do you call MRI scan or X-ray scan and all that, and if you upload those things to ChatGPT
Yes.
or DeepSeek can also give some remarks over that.
Yes.
You
Yes,
cannot rely on all that. We
Yes.
need specialized what do you call radiologist.
Yes, sir. Yes.
So technology can help the radiologist
Yes.
because sometimes we may not get all the points required at that stage.
Yes.
So the technology can give us some additional points. Okay, sir?
Yes, sir. Yeah, regarding this intelligent tutor system, sir.
Okay, sir.
In future, are we being faculty has been replaced by this virtual tutors, sir? Is there like that? We have to expect.
Sir, that what a common man thinks of. That what a
Yes.
common man thinks of. So I also said
Yes.
that a day may not be so far off when you don't seek admission in any of the colleges, including
Yes.
advanced institutes. It is not going
Yes.
to happen, sir. But now hypothetically, people are thinking that way. But we
Yes.
need to have human touch. That
Yes.
human touch is very important, and even in teaching also. Suppose
Yes.
in the beginning, no, what do you call the slides? In the beginning slides, I said about the traditional teaching, then no, what do you call the technology-based teaching,
Yes.
and again balanced. That balanced is very important. In
Yes.
every field, sir, not only in education, in medical education, in every field, that balance, that is, even AI creators, they themselves are telling that no, we need technology to help us,
Yes.
not to replace us.
Yes. Yes.
That what is happening, but in future, what is going to happen, we cannot say, sir, because
Yes.
there is so much of research going on this consciousness.
Yes, sir.
So how conscious, what is that consciousness and how it can be created? As of now, the technocrats are not able to do, scientists are not able to identify what's the source of that consciousness. We
Yes.
say consciousness is God, but all people do not believe that, no. So there's no God. Science is science, no God.
Yes, sir. Yes,
So
sir.
that's why in quantum computing, we go deep into the atoms. When we
Yes.
go deep into the atoms, what remains there?
Yes, sir.
Remains there is the infinite.
And yes.
Okay, you name it anyway as you like, but
Yes.
that infinite is there.
Yes. Yes.
Okay, thank you, sir.
Sir, yes, sir. As you rightly said, that with we as a faculty we should have a flexibility and adaptability and should have a balanced model of teaching. Thank you, sir. Thank you very much.
Thank you. Everybody.
introduction.
So good afternoon, everyone. Sir, Professor Siddaiah sir has given us an insight related with our national education policy to virtual reality and augmented reality with so many inputs for everyone to develop ourselves at individual level. It's not only at the college level or at the administrative level, but sir has given so many insights related with our medical education, related with the new education technology and education policy 2020. Sir, really we are very thankful to you, sir, for giving such an opportunity to listen to your extensive knowledge related with educational technologies, sir. And on behalf of our dear Vice Chancellor, Honorable Vice Chancellor, sir, Registrar Madam, and our group, and from all the faculty groups from different medical colleges, we sincerely thank you, sir, for giving an opportunity to listen to an extensive lecture, sir. Thank you.
Thank you very much, ma'am. Thank you all the participants for your overwhelming participation in this talk, and I must also thank Honorable Vice Chancellor, sir, and other faculty members who are here in the university for having given me this opportunity. It's a great day for me having interacted with the great doctors and the great medical professionals. Thank you very much. Have a good day.